All right. Good morning, good afternoon, and good evening from wherever you are tuned from across the globe. My name is Lucy Wanjiko, and I'm glad that you could join us. I am the head of communication at World Animal Protection, and I'll be your moderator for today. On behalf of World Animal Protection family, I welcome you to this webinar. Thank you for taking your time to join us and to be with us. I promise you that we'll make this time worth it. Before we delve into today's topic, let us take the poll. I'll project the poll question, and you'll have just about 2 minutes to take the poll, and then I'll share the results. There goes the poll. Please take the poll. We have the poll running on your screen now. Please take a minute and just answer the question that is up now. Thank you for taking the poll. I'll share the results now. Technical team, let's have the result up. Yeah, thank you. So for the question, which was who prescribes medication for your animals, 84% of us says that for the animals is the veterinarian who prescribes, and we have 16% who says that they prescribe the medicine or the medication for the animals themselves. Today we will see why you should not prescribe or give medication without the approval of the veterinary doctor, or in the case of human medicine, without the approval of a medical officer. So 84% doing very well, they wait for the veterinary officer, and 16% of us themselves, they do decide what the animal is ailing from and give them the medicine. So thanks for taking the poll. Remember to join our movement as the hashtags that were there before the last screen. Please follow us on Facebook. Our Facebook page is World Animal Protection Africa, and on Twitter we are at Move the World AF, and our website is worldanimalprotection.or.ke. For those who might not know, .or.ke is the Africa domain, so we are African wide, so worldanimalprotection.or.ke. Please go there and see the lot of work and information that we are doing. Now, we would like to make this session very interactive. So remember to type in your question on the Q&A that is up on your screen. Should you have any question, please do type it there. We will be able to address that when we are done. And should you also have comments or suggestions, and please do type them on the chat box. Again, it's up on your screen. We will endeavor to respond to all your questions and chats at the end of the presentation. For the media and journalists on this call, we thank you for the journey that you have walked with us. We will have a special about 15 minutes for one-on-one dedicated time with our presenter today. Please, so don't go away when we hang up. We will have 15 minutes just dedicated for you to have one-on-one with Dr. Yamo. Now for today, direct to the topic of today. As many of us might know, tomorrow, the Thursday, marks the beginning of World Antibiotic Awareness Week. It's called WOW, a week set aside to educate us about antimicrobials, or what we normally call antibiotic. And antibiotics is one of the most commonly used and misused drugs in the, across the world. To commemorate this week, here at World Animal Protection, we went out and did a survey, testing and analyzing the knowledge and practices of users of antibiotic in Kenya. We went out through working very much collaboratively with students, and we asked the public what knowledge they have and how they use antibiotics. And we looked at both the veterinary, that is for the animal side, and also the human side. Our farming campaigns manager, who is on the screen now, Dr. Victor Yamo, led this incisive analysis. And today he brings us the findings of this survey that we did. It took some time, and Dr. Yamo will tell us how long it took, and he'll give us the findings today. And Dr. Yamo is not new. He has been on our screens before. He's a veterinary doctor by profession with years of experience in research, campaigns, and also a lot of hands-on work. So he's well experienced, and he's the best person to not just do the survey, but also to lead the discussion today. So Dr. Yamo, we welcome you to this session. Please go ahead and share the results with us. We are all listening. Thank you very much. Over to you, Dr. Yamo.
Thank you, Lucy, for the introduction. Good morning, good afternoon, wherever you are. We will, as Lucia said, we'll just quickly go through the presentation that highlights the findings of the survey that we did last year around the time for World Antibiotics Awareness Week. And essentially, as Lucia said, it's just to look at practices and knowledge around antimicrobial use and the practices that we are doing. So it's as introduced, is simply analysis of AMR knowledge and practices in Kenya. We hope that in this coming year, we'll be able to do a similar survey or study in Uganda, Tanzania, and maybe Zambia, which will then be launching towards the end of next year, when we will be having the next World Antimicrobial Awareness Week. So as traditionally World Animal Protection, our vision is a world where animals live free from cruelty and suffering. And our mission is we move the world to protect animals. And I think the emphasis here is we, essentially to just say that we is not staff members of World Animal Protection, but all our stakeholders, all the general public, the people we interact with, to be sure that we move the world to protect animals, because protecting animals is connected to our livelihoods, it's connected to public health at a certain level, it's connected to food safety at a certain level. And I think as days go by, we'll continue emphasizing this so that at the end of the webinar, you can actually join us and be part of the movement that we're trying to create. We are in 14 locations across the world. And I think the important one for Africa is number 8. Which essentially to say that the Nairobi office manages our business across Africa. And currently we have just started the first year of our new strategic vision that looks at 2 goals. Goal 1 is to ensure farmed animals live good lives by transforming the global food system. And that is where the current piece of work is situated. And goal 2 is to stop wild animals being cruelly exploited as commodities by changing the systems that allow it. And this is the strategy that we'll be implementing over the next 10 years to around 2030. And so it's something that we'll continue laying emphasis on and highlighting in all our presentations. Having said that, then let's look at the study or the survey. Essentially, last year during World Antimicrobial Awareness Week that traditionally runs between 18th and 24th November, because of lockdown and being in a situation where it was difficult to get students together, we then decided to work with 13 higher education learning institutions, basically universities across the country. And we mobilized about 100 students and essentially requested them to go to their local agrovet shop or the veterinary pharmacy or the pharmacy shop and ask the owners or the counter staff at that shop a series of questions, but also ask customers who came into the shop while they are there a series of questions. And essentially that is what we did. And the results is spread around 19 out of the 47 counties where the students were, essentially at home, not near the institutions where they are learning. And the study was aimed at analyzing 4 things. One is the antimicrobial usage or dispensing patterns and changes attributable to COVID-19 pandemic. Remember, we were in the middle of COVID-19 pandemic. The second was to look at key drivers of antibiotic use and disease burden as reported to the pharmacists or observed in their farms. And the third was to understand the level of understanding of antimicrobial resistance. And finally, also to get the level of awareness of World Antimicrobial Awareness Week, considering that this week has been running and been celebrated in Kenya since 2016, 2017, thereabout. So we just wanted to see if the general public or the farmers are actually aware of this week. Results, I will start with the distribution. You can see that about 50% of the respondents were actually from the general public, the people who are found to be buying drugs in the stores that the students went to, followed by the pharmacy and then the farmer, and the agrovet had the least number of people, covering about 10%. And you can also see the spread across the country, and you can see a lot of that. The survey area was actually in the high potential area. And that is critical because then we will see how it then pans out in the results we will be looking at subsequently. In terms of demographics, in terms of gender, the most number in all the categories, the agrovets, the pharmacy, the public, and the farmer, almost 50%, slightly over 50% were actually male, the male gender, and females were about 40, as low as 31% amongst the farmers. The median age was around 30 years, although in the public one was about 26, and the farmers were slightly older at about 32.5 years. In terms of duration, that the counter staff had worked in the pharmacy or the agrovet, generally it was about 3.2 years for the agrovets and 2 years for the pharmacy. And then having animal health clinic or clinical training, about 69%, around about 70% of the respondents in the agrovets had actually had some level of training on animal health. And at the pharmacy level, about 88% of them had some level of training. And down there, we can see the distribution according to the level of education, with the highest number of pharmacy or agrovet staff having been trained at least at the diploma level, but some were slightly trained above that. So in the discussion, one of the things that was then asked was, what symptoms or diseases do they see, and why have they come to the pharmacy or to the agrovet? In the human side of it, the highest recordings was actually upper respiratory tract infections at about 24%, common cold and malaria then followed at about 17–18%. In terms of the agrovet, the biggest disease condition that was being seen was East Coast fever, followed by mastitis, and then a joint 12% between Newcastle and coccidiosis. And I think this is important to understand because when you look at the results that will be coming later on, you'll see that there is some level of disconnect between what the farmer or the individual who went to the pharmacy was complaining about and what was actually then being dispensed at the pharmacy or agrovet level. So if you look at products sold, just to continue that discussion, at the agrovet level, 58% of what was being sold was actually antibiotics, followed by 34% being antiparasitics. This would be things like antihelminthics, things like anticoccidials, and then vaccines was just at about 5%, and animal feed constituted about 3% of the agrovets that were sampled. In terms of pharmacies, the human side, antibiotics constituted 43%, followed by painkillers at about 21% and cough medicine at about 16%. And you can see the disconnect when you look at the symptoms that we saw earlier on. The biggest disease that was recorded in agrovet was East Coast fever, but you see that treatment for East Coast fever caters for just about 34%. So there's some disconnect there that we need to be looking at. The same applies to the human pharmacy bit of it. Okay, I think we've gone to. Now, in terms of antibiotics that were being sold, then looking at antibiotic constituted 58% in agrovets. The biggest antibiotic sold is tetracyclines at 61%, and in human medicine, the pharmacy, the biggest antibiotic sold was tetracyclines at 33%. So you can see tetracycline is the most commonly sold antibiotic over the counter in both the agrovet and the pharmaceutical store. Just to try and understand who then is buying the antibiotics or the drugs at the agrovet shop, because the human level, you assume it's somebody who's sick or unwell, but it's good to know what kind of farmer is actually then buying these drugs. So the biggest component of farmers that were buying drugs from the agrovet shop was the dairy farmers, constituting almost 50%. And that quickly relates to the area of the study. You can see we had said it's high potential areas where dairy farming is one of the big things that happens. Then it's interesting to note that the rest of it is then coming from chicken and poultry farming, broilers at about 8.5%, layers at about 14.5%, and indigenous chickens at about 15%. Then all the other animals, pigs, rabbits, sheep and goats constitute about 9.4%. So essentially, you're saying the biggest drug users then from this survey, it looks like it's dairy farmers and poultry farmers, which closely relates to work that has been done previously in this country, that a lot of drugs are going into the pig, into the dairy and poultry farming business. Okay. Then I think the other interesting finding was the fact that revenue, the percentage of revenue coming from antibiotics was significant. At the pharmacy level, almost 39% was actually, the pharmacy was making money from antibiotics. At the agrovet level, almost 30% of their revenue comes from antibiotics. And I think that is something which is critical and important, because it then drives to the understanding why there's a lot of antibiotic use in the system. Maybe sometimes it is being dispensed when it's not absolutely necessary for to be dispensed. And it's something that as an organization we've been speaking about, that it's critical and important to ensure that a proper diagnosis is made before the drug is actually dispensed. And that might be the reason why we are driving high levels of antimicrobial resistance in the system. When we then looked at the knowledge of the various categories in terms of antimicrobial resistance, it is good to understand that and appreciate the fact that there's quite substantial knowledge on antimicrobial resistance. 42% of the agrovets and 67% of the pharmacists have actually recorded or encountered antibiotic failure in the past, although the description of that was slightly different. But you can see there was various things: drug resistance, antimicrobial resistance, antibiotic resistance as descriptors around their knowledge of understanding of antimicrobial resistance in the system and in which they were working in. We went further to then look at what is driving some of these things, and you find that at the aggregate level, the use of antibiotics to treat viral conditions was something that was being done, catering for about around 47% of the samples. And then the sale of antibiotics without prescription was catering for almost 62%, 69%. There was also use of the understanding, and I think between agrovets and pharmacy, the understanding that it is not the body that is resistant, but it is the bacteria that is within the body that is resistant was also, it came out very clearly, because around about 85% in both cases were able to identify the fact that the resistance is not the body itself, but it's the organisms within the body. In terms of farmer knowledge of antimicrobial resistance, farmers were able to recognize the fact that antimicrobial resistance is both a human problem and an animal problem, and it can occur at both ends, with about 73% recognizing that there's levels of resistance at human level, and about 79% recognizing that there's AMR resistance at the animal level. And some of the drivers that then were proposed were things like sale of prescription antibiotics to animals, self-prescription of antibiotics to animals. And I think it is interesting that about almost 16-17% of the people in this call today or in this webinar today actually say that they actually self-prescribe. It's something that we need to be very careful about, because by self-prescription, we are not sure that we are treating the right organism, and maybe we are part of the process of ensuring that antimicrobial resistance continues to become a problem. The other thing that came out clearly was that there is incomplete use of antibiotics dose. A lot of us, when the animal gets well, if the doctor says give the antibiotics for 5 or 7 days, and if the animal gets well by the 3rd or 4th day, we simply stop giving the animal the full dose of antibiotics as was required. And essentially that drives the process where we end up with situations where similar situation is being seen at human level, because ultimately people who self-medicate after 2 or 3 days, once they feel they're getting better, they stop using antibiotics, and they rarely finish the full dose. And that then means that we are just selecting for resistant organisms. In terms of the public knowledge of antimicrobial resistance, about 13% were not able to tell the difference, and 44% did not know the difference between antibiotics and antimicrobials. And I think it's something that we also need to be looking at critically, because that's the genesis of misuse of drugs. It is important to understand that antimicrobials are any compound, chemical, naturally or synthetic, that is used for treatment. But antibiotics are specific medicaments that are used for treatment against bacterial conditions. And that is something that is important for people to understand. So generally speaking, antimicrobials are the bigger group. Antibiotics is part of antimicrobials, and the others like antivirals, antihelminthics, which are for the various class and category of organisms that we are dealing with. The general public were also clear around the fact that AMR is a human problem. 71% of them were able to say that there's a problem at the human level. Part of the problem is the fact that we do self-prescriptions. I feel I have a cough or a small cold, and I quickly go to the pharmacy, and at certain levels require and demand that I'm given certain drugs. There's also the fact that there's incomplete antibiotic dosage. Again, as I said earlier on, you feel you're getting better and you stop using the antibiotic before the full dose is utilized. And then the sharing of antibiotics, where if I have symptoms that are similar to my sisters or my spouse or my brother in the house, then I borrow the drugs that they were given. not realizing that symptoms could be similar, but the conditions that are causing it are totally different. So one of the things then we need to consistently engage the public to make them aware is that we need to take responsibility about the drugs and how we use some of these drugs. Okay, looks like I get. So finally, we then looked at the awareness, the level of awareness around World Antimicrobial Awareness Week. And essentially, as we had said earlier on, we have been celebrating this week since those days. We can see the banner there is for 2017. But if you look at the spread, amongst the farmers, almost 81% of our farmers are not aware that there's a World Antimicrobial Awareness Week. Similarly, about the general public, 81% of us are not aware that there's a World Antibiotic Awareness Week. But amongst the agrovet, almost 59%, 60% of the agrovets are aware that there's a celebration around that week. And amongst the pharmacists, almost 49%. So almost for 51%, sorry for that, 51% for pharmacists and 40% for the agrovets. So essentially what we are saying is that it seems that we have been talking to ourselves, and I think part of the reason why we did this survey and we are launching it publicly is to get the public to understand that there's a week that has been dedicated by World Health Organization, World Organization for Animal Health, and Food and Agriculture Organization to just look at specifics, how we are managing antibiotics or antimicrobials. Several years ago, it was Antibiotic Awareness Week. It has now become Antimicrobial Awareness Week, essentially because these are drugs that, if we do not manage properly, will end up in challenges in our production systems and also challenges in managing health problems. But for us as an organization, the important thing to understand is that the misuse of antibiotics or misuse of antimicrobials in production system is essentially because we are trying to mask the poor welfare that animals are living in. We're not providing them with good quality feeds. We're not giving them a clean space and comfortable space for them to live in. We are not ensuring that disease control is managed at their level through vaccinations and through things like biosecurity and hygiene and sanitation. And these are some of the things that we are starting to say that are becoming critical, and we need to then change our ways to ensure that as we celebrate the week and we raise awareness, that ultimately we are delivering on the welfare of the animal and ensuring that the animal is catered for to minimize the spread of antibiotic resistance in our systems. So in summary, we are saying that knowledge of antibiotics and antimicrobial resistance is present amongst the general public and the population, and you could see the high levels of understanding and people being able to differentiate between antibiotics and antimicrobials at certain levels. However, the improper practices persist, and such practices include things like self-prescription of antibiotics, both at the human level and the animal level, not completing the antibiotic dose when it's recommended, again, at both levels, selling of antibiotics without prescription, something that we need to work around because antibiotics are actually prescription-only medicines, and they need to be having a prescription, and then sharing antibiotics, again, happening at both levels. We also realized from the study, we've also concluded that pharmacy attendants are more likely to have clinical training more than agrovets. And I think it's a tendency around where we employ our relatives who might not be competent at the agrovet level to try and manage some costs. And part of addressing that is continuous professional development training at the agrovet level, where we train counter staff, but also looking at processes. We have developed manuals with people like OIE around infection prevention control methods and biosecurity and responsible and prudent use of antibiotics that needs to be driven out there. We also realized that antibiotics are the most commonly purchased drugs, and are often without prescription. 58% of the agrovets were selling antibiotics, and 43% of the pharmacies were selling antibiotics. That is something that was very critical. And again, from the studies find that about 39% of the pharmacies and about 30% of the agrovets, 30% of the agrovet revenue are actually coming from antibiotics. And we then need to ask ourselves, is this part of what is driving the excessive use of antibiotics? Because at the agrovet level, maybe it's just selling to make money instead of looking at the wider public health implications of some of these things. And then tetracycline is one of the most common antibiotics sold across both agrovet and pharmacies. And then finally, there were low levels of awareness of World Antibiotics or Antimicrobial Awareness Week. And I think we need to start looking at innovative ways to then engage the general public, especially during events like this one. And that is why, like, as an organization, we've decided this year not to do the event, to take the events in Nairobi, but to move to the coastal province, to coastal region, to then engage students at that level, so that the message starts going out to the general public and to the counties that are a bit far off from the middle. So in conclusion, we are saying as an organization that antimicrobial resistance is something that we are going to have to deal with, and we must face it squarely. And we're asking industry to improve animal welfare, both the industry that where the producers are, whether they're dairy or poultry or pigs producers, they need to start having policies around prudent use of antibiotics, where antibiotics are only used to treat animals which are sick after intervention of a veterinarian who then has made a diagnosis, and then ensuring that antibiotics are not used prophylactically during the production system. But it goes beyond the producers. We also need to engage the retailers and the food industry, the general foods industry, to ensure that whatever we are doing is ensuring that the welfare of the animal is catered from at the production level, and that then negates the use, the requirement or use of antibiotics unnecessarily. We're also asking international organizations like ourselves and governments and the veterinarians to support responsible use of antibiotics by industry through suitable policy and regulation. I know we are currently, as a country, in the process of developing an animal welfare and protection bill that is going through the system, and an animal health bill that is also going through the system, and an animal health, a veterinary public health bill. All these things have aspects around antibiotic usage that are becoming critical to ensure that then the general population is getting food that has not been contaminated by antibiotic residues, neither is it contaminated with superbugs, which are essentially organisms that are resistant to antibiotics. And lastly, we're asking consumers, and that's why we are talking to the general public and through media, to support higher welfare production systems, because this then ensures that the animals are healthier. They do not then end up getting sick, which then introduces antibiotics into that production system. But they're also able to produce good quality products, because whatever products come from them will not be contaminated with superbugs or antibiotic residues. And that then ensures that the consumer gets a better product at the end of the day that is food safe and does not have any negative impacts on their to combat antimicrobial resistance. That piece of document recognizes that increased animal welfare as a prerequisite to reduction of antimicrobial use. And that is the position we are taking as an organization, that we need to cater for welfare of the animals, and we need to be moving to higher welfare production systems that then caters for the welfare of the animal in production system, in farm animals, and in food systems. And that is the only way that we'll end up with a sustainable production system that ensures that we end up with high food safe, very safe foods from using animals as production for the food that we eat. I think that's my last slide. I want to hand it over back to, just before I hand it back, we had said that we are starting or raising awareness of World Antimicrobial Awareness Week that starts tomorrow, the 2021 one. And the theme for that week is spread awareness and stop resistance. And I think what we are asking as an organization, as part of the wider group that is the World Antimicrobial Awareness Week Committee, is that we start looking at how do we spread awareness so that we stop the resistance against antibiotics. And as indicated on that slide, there are several antimicrobials that we are looking at, antibiotics, which are working against antibacterial and against bacteria, antivirals that are used to treat or manage viral conditions, antifungals that work against fungus, and antiparasitics, which are things like dewormers that work against worms and parasites for that matter. So it's that whole category of chemicals that we are looking at, and we're saying we need to stop resistance against these chemicals by spreading awareness on responsible use of the same chemicals, and by raising awareness amongst the general public, so that we drive that process to ensure that ultimately we are stopping the resistance. Because as it's been said in literature, if we go at the rate we are going, by currently we are losing about 700,000 people because of misuse of antibiotics and leading to antibiotic resistance. If the trend stays the way it is, by 2050 we'll be losing 10 million people annually, and it's something that we don't want to do. It's also critical to understand that there are no new chemicals being generated to replace the current antibiotics, antivirals, antifungals, and antiparasitics that we have. And hence it behoves that we ensure that we utilize what we have prudently so that they can last a bit longer, and ensure that we are managing that process at a level that then reduces resistance. With those few remarks, I want to say thank you very much, and hand it back to Lucy, who can then engage us with questions and comments. Thank you very much. Over to you, Lucy.
Okay, thank you. Thank you, Dr. Yamo, for the very incisive presentation. We now look at the Q&A, and yes, we have a few questions coming through, and I want to urge you who has joined us. We are over 60 people on the line today. Please continue testing and texting your question there at Q&A, or use the chat box for any suggestion or clarification as need might arise. So let's go to Q&A, Dr. Yamo. We have Ismail Ari Hamis, all the way from Zanzibar. Ismail says, hello, doctor. My name is Ismail from Zanzibar Health Research Institute. Don't you think that the AMR problem is somehow related to the human antimicrobial resistance? Ismail from Zanzibar Health Institute asked, don't you think that this AMR problem is related to human antimicrobial resistance? So maybe it's, so what is the relationship between human and animal antimicrobial resistance? I will ask Victor, you take that as I explore the others.
Indicated that the two are related, because one, the antibiotics that we are using are the same antibiotics. There is and you could see from the presentation that the most commonly used antibiotics in the agrovet is tetracyclines, accounting for almost 60% of the samples. And similarly, at the human pharmacy level, 33%, and the most commonly used antibiotics was tetracycline. I think people fail to realize that it's the same compound. There's no tetracycline that is for animals that is not the same one that is being used for humans. And so that's one of the things that we need to look at critically, because if you consume milk that has tetracyclines, for instance, essentially what you are getting exposed to is low levels of that antibiotic. And essentially then you will end up with a situation where you have problems with your problems at the human level. So that's one of the things that we need to look at. Then the second thing is that, and it's studies that are still going on, the organisms that carry the resistance gene are in the same environment. Is there possibilities of crossover? Is there possibilities that a resistant organism from, say, the human side might end up contaminating and bringing problems at the, say, the animal side? So it's something that, again, studies are still ongoing, but essentially as we develop knowledge, essentially, the thing is that both ways, there are impacts from animal side that ends up impacting on the human side, and vice versa, the impacts at human side that then ends up contaminating the animal side. Hence the reason why for management of AMR, we say that you need to do it in a One Health sort of process where you are looking at what's happening at the human side, what's happening at the animal side, and what's happening in the environment. And I think over the next year, we'll be looking at environmental contamination, maybe from large farms. Is it something that we need to be worried about? And so it's something that, in a nutshell, we are saying they're interconnected, and there's no way that you can deal with AMR at animal side and not look at it from the human side. Thank you. I hope that clarifies it. Thank you.
Yeah, clearly it does, Dr. Amo. I want to, also alert that we'll be hosting this presentation on our YouTube. So for those of us who are asking for the presentation, it will be on our YouTube. We'd as well send you the audio. After this, we'll send an audio clip that you can use for your radio station, and we'd also send you a B-roll for TV. And in addition, you'll also get this presentation in your inbox immediately after this webinar. Naftali Muigai. Victor, we have Naftali Muigai from the Zinua News Agency. He asks, are there any specific health environmental hazards linked to misuse of antibiotic that has been observed in Kenya? Naftali Mwaura asks, do you have any specific health environmental hazards linked to misuse of antibiotic that has been observed in Kenya? Is there any case of antibiotic misuse that you can highlight, Dr. Amo?
Yeah, as an organization, thank you for the question, Naftali. As an organization, earlier in the year, we did a survey looking at work that has been done across 8 African countries, mostly in East Africa. And you'll find that there's been quite some work around antimicrobial resistance in various foods. What we are now looking at, and I've alluded to, is that we are looking at the connection or the nexus between what is happening at farms and what is happening in the environment. The theory is that, or the hypothesis is that there is, when we are managing waste from farms, what do we do with that? Most of that waste goes into the environment as manure. And there's some level of contamination with the antimicrobial resistant organisms that we could possibly occur, and is something that we as an organization are interested in studies, and we are working with one of the Kenyan research institutes to look at that into next year. But I also know from other studies that there's been a lot of hue and cry around how we dispose drugs. A lot of us, when we have expired drugs or antibiotics that we are no longer using, we throw it or dispose it in the bins or with the rest of our takataka from our houses. Essentially, that then ends up in the environment, because either it will end up in Dandora or these big places where the dump site where they are dumped, and that then means that that chemical then is in the environment. When it rains, it can run off, the rain runoff from that dump might end up in somebody's plants or in some other pieces of environment. We're even looking at it, whether it ends up in waterways, the rivers or streams. And that is something that is becoming critical. And I think there's discussions around how do we then manage drugs that have expired or that we are no longer using. And it's a big project at certain levels, because how we dispose it becomes very critical. And that is something that is important because of the connection with our exposure, how we dispose our waste products always ends up in the environment, in big landfills or in big dump sites. And that is something that is very critical. When that chemical then is in the environment, in soil or in water, it then has impact on the organisms, the natural organisms in that soil or water, which then has an impact with human health or animal health later on when the cycle is completed. So there's actually a connection. That's what I'm trying to say. And it's something that studies are still ongoing, but there's already concerns around some of these things. And I think organizations like NEMA that are looking at environmental safety and environmental health are beginning to have certain requirements on how you dispose of drugs that are no longer being used either from the animal health systems or from the human health systems. I hope that clarifies the situation for you, Naftali. Thank you.
Thank you, Dr. Yamo. So we'll take the final question, and after that we'll move to the journalist questions. So for journalists, please do remain behind. Dr. Yamo will just take this final question, and then we move to one-on-one with Dr. Yamo. Yamo, we have a question from Abby Winston. Abby Winston, all the way from Turkana County. And he asked, the county, that is the Turkana County, has very few government veterinary doctors and private practitioners. Hence, the county is vast and lots of goats, camels, and goats. How will wild animal protection create awareness about AMR in these remote areas of Turkana? Winston from Turkana asked that the county of Turkana is very vast with a lot of goats, herds of goats, camels, and cows. How will wild animal protection create awareness about AMR in this remote area? And just before you take that one, I'll add you the second one, Dr. Yamo, is from Motuma Regasa, all the way from Ethiopia. He says, I am Motuma from Ethiopia. Improper diagnosis of disease is one cause of emergence of drug-resistant organism. Is there an advanced technology that identifies the agent to treat the disease? Motuma from Ethiopia, thank you very much, joining us all the way from Ethiopia. He asked, improper diagnosis of disease is one cause of emergence of drug-resistant organism. Is there any advanced technology that can identify, target the agent, and treat the disease? So it's a question on availability of technology. Dr. Yamo, you take those two questions, and then we move to the journalist question. Over to you, Dr.
Yeah, thank you, Lucy, for those questions. Thank you, Winston from Turkana County. I think yours is the easier one to answer, because essentially when we started off, we said our mission, which is still behind me there, is we move the world to protect animals. And I clearly elaborated that we is not wild animal protection alone or staff employed by wild animal protection, but gentlemen and ladies out there, somebody like Winston, who has been on our webinar and has understood that AMR is a problem and it needs to be managed. You then become part of the people who then raise awareness at the county level. In fact, our hope is that every one of us can take responsibility. If all of us then went back to the counties that we belonged to, we would essentially be moving and ensuring that people then understand that certain practices that they are doing are part of the problem that then leads to antimicrobial resistance becoming a challenge. I also know and understand and appreciate the fact that you're saying there are challenges with the number of veterinarians on the ground or the animal health technicians on the ground. I think that is then at the next level of challenge, where we then ask you as somebody in that county where you have a voice to then engage the county government There are Kenya Veterinary Association branches across this country that you can work with to engage the county government to ensure that if livestock, and in Turkana, livestock is one of the big things that they're looking at and one of the sources of livelihoods for the people of Turkana, then the government, the county government should be employing enough vets and technical men on the ground, vet technicians, vet technologists, animal health technicians, so that you have enough that covers the ground, and the international standards around how many veterinarians are required against how many number of animals, and something that beyond just looking at it from World Animal Protection, raising awareness, is also being proactive to engage county governments to ensure that the right number and the right people are on the ground to be able to manage that process. For Motuma from Ethiopia, again, very good question. I think the diagnostic facilities have really, over the last 2 or 3, 5 years, have really improved in leaps and bounds. Yeah, when we started off, it might have been taken you 3 or 5 days to then diagnose and find out exactly which organism you're dealing with, which then led to delays in the actual treatment. But these days we have very proactive pen-side diagnostic kits that somebody can engage with. We have laboratories across, sitting here in Africa, some even in Ethiopia that I'm aware of, that can even do genetic, use genes to determine which organism you're dealing with in a sample. So the diagnostic facilities have moved and improved drastically across the continent. What we need to do is to ensure that we are using them and utilizing them immediately when the outbreak occurs. I think the challenge you're having from an animal health system perspective is that a lot of us don't take good care of animals, and when they fall sick, we do not urgently take them to take precautions or take them to the veterinarian or consult the veterinarian. In my experience in this country, the veterinarian is consulted as a last resort. We first try to treat it ourselves, and that's why a good chunk of us said we do self-medication of our animals or self-prescription of the animals. And then when it fails, then we go to try and find help from our neighbors before ultimately getting to the vet. That process then takes a while, and that is what delays the actual diagnosis. In good production systems, the producing institution needs to have a vet that is consistently there, who's doing what we call hard health, who is looking at the animal. He can see the signs of diseases, can intervene earlier on before the animal actually gets into the situation where it falls sick and then needs to be treated. And when the animal falls sick and needs to be treated, there needs to be an urgent veterinary intervention that ensures that the animal, the correct samples are collected and the correct diagnosis is made within the shortest time possible, so that we use the drugs that we have prudently and the one that is correct to treat that disease. I think I'll leave it at that. Lucy, back to you. Thank you.
Okay. Thank you, Dr. for the great work answering our questions. So what we'll do now, we'll take a short break, just about 3 minutes, so that we can prepare for the journalist questions. And I can assure you that there are a lot of questions coming up, but again, we are not saying if you still have time and you want to remain behind, please remain. We are only taking a short break so Dr. can take a glass of water and we come back and take the journalist questions. Do we have anything from the technical side? Dr. You've taken your water. Seems you are not as thirsty as we imagined. So we will carry on.
I've actually taken my water.
Okay, lovely. So we will carry on. And I want to welcome all the press, the journalists who are on this call. What we'll do, if you have a burning question and you want to ask, you can raise your hand, we will unmute you, and you can ask your questions live. So if you have any question, you're online, just raise your hand, we will unmute you, and you can ask your questions live to Dr. Yamo. But as we do that, Dr. Yamo, just a question, we'll look at more questions. We have a question from Laban Muhindo from Uganda. Laban says, I would like Dr. Yamo to elaborate more on the point of how many people we lost as a result of misuse of antibiotics, especially in animals. Dr. Yamo, how many people have we lost as a result of misuse of antibiotics in animals, and what can be done to overcome it? What can we do to overcome this? This is a question from Dr. Yamo. Over to you, Dr. Yamo.
Yeah, thank you, Lucy, and thank you, Laban, for that question. According to World Health Organization, because of irresponsible use of antibiotics, we are losing about 700,000 people per year globally to infections that cannot be treated because they found themselves with an infection that no longer responds to any known drugs. And it's estimated that we will be losing about 10 million people by 2050 if we do not do anything about it. And so that is why the tripartite, as they are called, FAO, World Health Organization, and World Organization for Animal Health came together around about 2015 and said we needed to raise awareness around use of antibiotics. That's where it started, but a year ago it was changed to antimicrobials. The three organizations then have worked with governments for various countries to develop what are known as national action plan and policies for reduction of AMR. And the reason why they're doing that is because, as I said earlier on, there are no new chemicals that are being developed to replace what the organisms are becoming resistant to. And where they're being developed, the resistance is becoming, the organisms are developing resistance a bit faster. And so it is important and prudent that whatever we have is used prudently. And that goes back to why, as an organization, then we say one of the points that we need to be looking at is how we are managing animal welfare. And I already alluded to the fact that poor welfare in production systems leads to overuse of antibiotics, which then ends up in our food chain, either as antibiotic resistant organisms or residues. And that then gives us challenges, a part of the challenges that we're having right now. But specifically, as you've asked your question, you wanted to know how many people are dying because of poor use of antibiotics. What I've given you is the overall figure. There are still studies that are trying to determine whether the connection, but essentially we are saying that because of antibiotic resistance, we are losing 700,000 people every year, with the possibilities that if we continue on the same trend, we'll be losing 10 million people every year globally. And it's estimated that antibiotic resistance is going to be the next big pandemic. It is going to be bigger than a combination of infectious diseases in human beings that are not going to be killing more people than the resistance itself. Thank you. Back to you, Lucy.
Yeah, thank you. Thank you, Dr. Yamo. I was looking if we have any raised hand, but I want to just alert Johnson Masinde. You are saying that you are working on a ZooLink project in Western Kenya around AMR. At some point, I'll call upon you, Johnson Masinde, to just give us a brief on what you are doing and what you are finding, and also what you are planning to celebrate the AMR week. Wangari Dirango, Dr. Amo Wangari Dirango asks, as the world marks Antimicrobial Awareness Week starting tomorrow, where is Kenya in terms of addressing the threat? Wangari Dirango, As the world marks Antimicrobial Awareness Week, which begins tomorrow, where is Kenya in terms of addressing the threat? Where are we? 10%, 20%? How are we doing in terms of addressing this global threat of antibiotic resistance? Okay.
Thank you, Wangari. A very good question. I think part of the answer is something I'd already alluded to. In around about 2017, when we were celebrating World Antibiotics Awareness Week, then we as a country launched the National Action Plan and Policy for Reduction of Antimicrobial Resistance. And that action plan is hinged on studies that are done in this country to show where the problem was at the animal level, where the problem was at the environmental level, and where the problem was at the human level. And so as we are speaking today, there is a national steering committee that has been managing that action plan, which as World Animal Protection we contribute to. The steering committee then has developed certain documentation, some which will be launched on Friday when the official launch for World Antibiotics Awareness Week, World Antimicrobial Awareness Week for this year will be done. So I think you will need to keep yourself close to that. But there's actually an action plan that has been running and is ending in 2022. And I think in terms of delivery, I am not the right person to speak about it because it's a government document. But I know on Friday when there'll be the official launch, the relevant government ministries, Ministry of Health, Ministry of Agriculture, and even the Ministry of Environment and Natural Resources will be speaking to that document, and they will be able to tell you as government how far we have been able to deliver on that action plan and that policy, and what plans we have going into next year when the current action plan ends, and how we want to pick it up, because it's something that we need to continue going. I know that the week itself brings together, every time it has been celebrated, brings together all key players from NGO, from government, from all, international partners like FAO and OIE. And that then helps to drive that process. So essentially what we are saying is there is a plan, it has been delivered. I am not the right person to say whether it's 20%, 30%. I think that will be delivered on Friday when the official launch will be done. And I think the question is very good at that level, because we need to hold ourselves accountable to certain things we've committed to. If AMR is a big problem, then, and part of the reason why we are raising this awareness is for us then to hold government responsible for certain things. Part of that program, so that I bring it home, it says that we will be developing county teams or county committees that look at antimicrobial resistance at county level. And I know several counties have developed that. And those counties then, at county level, we are then able to manage it at a localized level, while the national team looks at it from a national perspective. And I think as good citizens, we need to ask whether our counties have the right team in place. And if our county is one of those where the team is not yet in place to manage antimicrobial resistance, then we need to be asking questions of our county leadership, why they are not part of that process when this is the next big pandemic that we're looking at. So there's progress. I think if you really want good answers, wait for Friday when the official launch is being done by the government officials and the National Steering Committee, and that then will be able to give you the right answers. Or if you can't wait until Friday, we can point you to the right persons, because there's in each of the ministries, there's a focal person that is looking at this particular process and leading it. And I'm sure they will be willing to engage and give you the status at that level. Thank you.
Thank you, Dr. Yamo. We have hands up. We have John Waithaka. John Waithaka, your hand is up. Please go ahead and ask the question. I'll ask our technical team to unmute Waithaka. right, as we prepare to get Waithaka back online, we have Dr. Yamu, we have a question from Dagize Joel from Uganda. Dagize asked, I'm Dagize Joel from Uganda, but let all of us know we are few people who can. Okay, he says, we are only a few of us who can process this information. Could you please upgrade this information to the last man? So we are only a few of us who know about antibiotic. Is it possible for Wild Animal Protection to cascade this information to every person across at least Africa? Yamu, what are our levels of communication, and how can we get this information to the last man, as Dagize Joel calls them?
Yeah, thank you, Joel. I think we as an organization, we have a strategy and a vision that you're following, and part of it is raising awareness, especially on matters that touch on animal welfare. And this is one big thing, because we are realizing that poor animal welfare is being propagated by use of antibiotics. But the way we work as an organization is we engage with like-minded people and individuals at various levels. We work with partnerships, we work with partners. At Uganda, I know we've worked closely with Uganda Veterinary Association, for instance. We have been involved with Makerere University, where we have engaged with the student population and tried to teach them this process. And so at our level, we are trying what we can do. But as I said, our mission, again, which is just slightly behind me, Joel. When we were in Uganda and when we engage Uganda, we have also worked with the Uganda media, and I know I've been in several TV and media stations in Uganda. And essentially the same thing we are trying to do. We are part of the process of trying to raise that awareness, but as an organization, we recognize the fact that we cannot do it alone, especially if our remit is Africa, and we have one office in Nairobi that is trying to look at 54, 55 African countries. And so it's important that we get people like Joel on board, so that Joel, in his own small way and in a small place where he can influence, can also drive that process and ensuring that he is able to give that information. And when we started off, we also shared our links to our digital platforms, our Facebook, our Twitter accounts, because again, you can get even our website, you can get some of this information or reports that we are talking about even in our YouTube channel, which you can then use to educate the masses around where you are, where Wild Animal Protection, the staff for Wild Animal Protection cannot actually reach, but you as Joel on the ground, and you can reach these people. You can use that information. We also work with governments to develop certain policies and regulations, and that also becomes critical, because that enables governments to then see how best to engage with the general population that they are accountable to. And so again, we are consistently, and because of the COVID challenge, we might not have done a lot of work this year in Uganda, but hopefully when the situation settles and we are clear on how it pans out, we're hoping that next year we'll do some more activities in Uganda around antimicrobial resistance and management of antimicrobial resistance, working with the relevant government bodies and also with the relevant institutions and associations like the Veterinary Association to deliver on that and to ensure that the process and the awareness is raised. And of course, engaging the media. And part of engagement with media, which I think my head of comms can attest to, we also train media, and I know we've had media training in Uganda so that the media knows and understands the subject matter. We know it's a bit technical, but when they know and understand, they can then be able to write the correct articles, ensure that the right information is getting to the levels at the lowest level possible. So there are various things we are looking at, tactics and activities that we are planning. And those all those drive that process. And as a critical stakeholder who has then joined us today, you can also give us suggestions of what you think can be done and how it can be done. We can get to that lower level, working with you as part of the team that we are engaging with. I think I'll leave it at that, Lucy, and back to you.
Yeah, thank you. And just to add to what Dr. Amo has said, it's one of the other things that we do as well, animal protection. Of course, we use the media, but we also look at culture and art. And also to mention for the people who are in Kenya, around Mombasa, where we are doing this webinar from today, is that we will have a cultural extravaganza to create awareness about antibiotics on Saturday at Fort Jesus. So we have artists who have composed songs, who will also record for further production with the radio stations and TVs. So if you're around, please come and check us out. We'll be there. And on Facebook, we have been running a competition about AMR. And if you are on Facebook, on our page, which I urge you to go there because we do a lot of activities there. We will be doing a lot of challenges up to next year, just to create awareness and to create a movement of people who are dedicated to ensure that AMR does not become a challenge. So those are some of the platforms that we use. If you're in Mombasa, join us on Saturday. You'll have a lot of fun, and we urge you also, if you're in the media, also broadcast it out. And what we are doing here, also ensure that it's published and it goes out to the media station that you work with. And please, as you do that, share with us the link, either on WhatsApp or even on email. And after this, we'll share our email address, which you can please share everything that goes out. We also want to keep a track of what we are doing. So as we wind up, we have two people who have raised their hands. I think we'll take those two, and then we will call it a day. We are at 11:20. So we have three people now. We'll start with Jean Claudia from Rwanda, and then we'll hear from John Waithaka. Jean Claudia, over to you. I will ask that you unmute. Yeah, John, then we have Jean. Okay, please
Hello?
go ahead. Let's start with Masego from Rwanda and then Waithaka. Thank you.
Hello, thank you very much for this interesting topic. My name is Jean-Claude. I'm from Rwanda, and I'm the director of Rwanda Animal Welfare Organization. Definitely, the antimicrobial resistance is really a concern for us, and we would love to make awareness by advising farmers to do not treat the animals on themselves. So my question is to ask, how could we work together with wild animal protection? Thank you.
Thank you, John Masego. Let's hear from Waithaka now. Over to Waithaka. Please unmute yourself. Waithaka, you are live. Your question, please, John Waithaka. Okay, seems we have lost John Waithaka. Dr. Yamo, please take the question from Jean Masego from Rwanda.
Yeah, thank you, Jean, for that question. I had already alluded to the fact that as an organization, we work with partnerships. And so as a director of an animal welfare organization in Rwanda, I think what you could do is just use our contacts to quickly get in touch with us. We see what is feasibly possible for us to, and which areas we can work together. I think there are opportunities It's just a question of discussing and clarifying which areas, what are your interests, how do they align to our organizational interests, and what are the opportunities available. And then we can pick it up from there. So I'd urge you to pick the conversation offline so that we are clear on what we can do together in the coming year. Thank you.
Okay, thank you, Dr. Yamo. And thank you for all of you for participating in this webinar. Unless we have a burning question or suggestion, we will leave it here, but not before I read a few comments from our participants. Masinde, I tried to locate you. Masinde from, good morning. No, not Masinde. We have Lamin Saikaro from Ghana. He's a veterinary paraprofessional. He says this is a good presentation. Thank you very much, Lamin. From yeah, Mutuma, I read that one. Martin from Radio Simba, Uganda. I request a copy of the presentation and the recording, and that one you'll get. Yes, is a comment from Ismail Ari Kamis. Ismail Ari Kamis is delighted to be here, and he requests that each participant is given a certificate of recognition for participating in this webinar. For Ismail Ari Kamis and everyone else who is on this call, we say that we'll be looking at that very keenly to see if we can do a certificate, especially in our forthcoming webinar. And Wangare says, thank you, Dr. It was a good presentation. Now let's get down and write good articles. I agree with you. Let's get down and get to write good and great articles and share with the community, share with the public out there. Let's create this awareness. Benson Kingori, thanks for this information. I hope many people, especially farmers, get access to this information since they are rearing antibiotic food broilers from day one. Kingori in Kirinyaga. Asanteni sana. We'll get all the presentations on your email. Thank you for your participation. Let's keep the conversation going on our Twitter page and on Facebook. And please also remember to tweet us. We'll have a press release after this. And at the end of this, we'll also have our media contacts on the screen as you go. So thank you and see you soon. That is the Evans email. Evans is our media officer. And please, as you leave, I hope you are also leaving your email address behind so that you can be able to send you the presentation and the press release and the other press assets that we have prepared for you. Thank you very much.
At World Animal Protection, we know that every animal counts. We're a global animal welfare organisation and have been campaigning for over 50 years to end animal cruelty. We work to achieve global change. Every day, billions of animals are experiencing unbearable cruelty. We tackle the root causes of their suffering so that we can make the biggest difference to their lives. We give a voice to the voiceless. Our world is changing fast. As people face urgent issues like the climate emergency and depleting natural resources, we give animals a voice and ensure their needs are met because we all call our planet home. Right now, we're prioritising issues where change can transform the lives of the greatest number of animals, overhauling the global food system. And ending the cruel exploitation of our planet's wildlife. We know that the fate of animals' lives rests in our hands. Our passionate teams inspire and mobilise individuals and organisations to create change. We support local and global movements that are fighting for a better future for animals. Our knowledge and expertise give us a powerful voice at the most influential levels of government and business, where we establish animal welfare as a global priority and a local concern. Though the challenge is great, our determination is greater.